I'm going to go over one of my favorite simple but effective modalities that I use all the time. Kinesio Tape. Kinesio Tape has been shown to support and relieve pain in muscles, joints, and ligaments. It can reduce swelling, increase mobility, and speed recovery. I use Kinesio Tape quite regularly at the office to help with injuries and have used it in the gym to help with performance and injury prevention. It's great to use across joints because it doesn't limit range of motion and it stretches with the soft tissues. Kinesio Tape assists with the body's ability to heal itself and can provide therapeutic relief to a variety of populations. After an injury, blood and other fluids can build up, causing inflammation and swelling. If there's too much inflammation, the excess is not able to be removed by the lymphatic system. The lymphatic vessels become compressed, which prevents oxygen and nutrients from being delivered to the healing tissues. When Kinesio Tape is applied, the elasticity in the tape lifts the skin from the tissues below. This lifting of the skin creates space to improve blood and lymphatic flow, which helps to relieve pressure and reduce swelling. Once blood flow is restored, oxygen and nutrients are better able to reach damaged tissues. I'm going to now demonstrate a small application. This is Lauren. She's going to assist us with demonstrating how Kinesio Tape works. So let's pretend that Lauren has been working long hours at the office, keyboarding all day, and so her hand has been in an extended position and she's getting a lot of pain in the back of her forearm. So this probably will have some swelling and be inflamed and painful, maybe even shooting down the arm, but just for a sample application. So what we first want to do is locate the area of pain. There probably will be some inflammation, some swelling, but what we don't want is an exposed wound or anything like that. It should be nice, healthy, fresh skin. So the idea is, I like to do like an asterisk pattern, so a cross pattern across where the injury would be. So for instance, with this type of injury, I like to break the Kinesio Tape, use whatever brand you like. This is a brand that I am fond of. We break it in the middle, try not to touch the ends. We do a little stretch. We say 35 to 50% stretch in the middle, and we put that center of that piece right where she's feeling pain. And then we lift the tabs and we apply the tape. The reason we don't put stretch on the ends of the tape, on the anchor pieces, is because that can cause skin irritation. So we do the same thing with the other pieces. These might be a little big for this area, but just so you can see in demonstration. And we'll go stretch, and then we'll cross right at the area of pain or swelling or inflammation. Lay down those tabs, and we'll do the third piece again, middle, stretch, place, and she'll feel as I'm putting this on that there will be an area here where you can feel the tape decompressing. So the idea is when we put it on with the tape stretched, it grabs the skin and pulls the more superficial layers of tissue away from the deeper, and so it's allowing for that better blood flow between those tissues, which, as we said before, brings more oxygen and helps the lymphatics drain. And so for the fourth piece in this area, stretch, place, and lay those anchors down. So usually I tell people they can leave this on for 3 days. You can shower with it. If it starts to itch or irritate you at all, just take it off. I like to apply it, and if I'm going to shower, I'll take it off and I'll just reapply it. I love to use it forearms. One of my favorite places is the angle of the scapula here. Like I was saying, office work, a lot of people get pain through there, and if you apply say that same asterisk pattern here where this muscle comes in, it's kind of a trifecta of stress on those muscles here, the trapezius, the levator, and the rhomboid. And also, if you have people that have, or you yourself or family member will have sacroiliac pain down in this region on either side of the lower spine, this technique works fantastic to alleviate inflammation, pain, and pressure in either of these regions here or centrally in the low back. So that's one of my favorite techniques. It's cheap, it's easy, it's effective, it's wildly effective. I was actually really surprised to find out how well it worked. When I first discovered the technique, I had been doing CrossFit workouts, and I developed a bilateral patellar tendinopathy, both my patella tendons. I had it for about a year, and none of the physical therapy I did would address it at all. And I ended up putting two small pieces of stretch tape on my patellar tendons, and within a day or two, I haven't had pain in over 5 years. So it was just a nice, easy technique, easy to learn and easy to apply.